want parents to be able to check and look at their child as they sleep. There should be no sounds. Any sounds is a sign that they're getting obstruction of airflow. And we know that if there is any snoring, there's a lot of research to suggest that this can be linked to increased risk of behavioral and learning difficulties later on in childhood. And many parents have these concerns about their child's inattention or their difficulties with emotional regulation or managing themselves.
That was Dr. Shereen Lim, and you've landed on the Me&My Health Up Podcast. I'm your host, Anthony Hartcher, your concierge, nutritionist and lifestyle medicine specialist. The purpose of this podcast is to enhance and enlighten your well-being. And I've brought Shereen Lim on the show to do that just for you on the subject of overcoming snoring. So yes, do you know a snorer in your life? Do you want to help them to give you a peaceful night's sleep? Well, this episode is for you. This episode is also for the parents of children who have sleep issues, sleep disturbances, may have trouble focusing at school, behavioral issues. It's also for you and to help you with your raising of your children. So without much further ado, I'd love to welcome you into this conversation I'm having with Dr. Shereen Lim. Welcome on the Me&My Health Up Podcast. How are you, Dr. Shereen Lim?
Yeah, going very well, Anthony. Thanks for having me here.
So great to have you on. Where are you joining us from?
I'm from Perth in Western Australia.
Another Aussie. So really good to have you on, particularly around your area of expertise. And I'm looking forward to sharing that with the listeners today on all things dental health, sleep and breathing. But before we get into that, I would love you to share with the listeners how you've arrived at what you're doing today.
Sure. So I'm a general dentist. I have been for about 27 years. And around 15 years ago, it was my husband snoring that was driving me pretty crazy. So I got out of bed one night and I decided to research all about dental sleep appliances. There are appliances that can be worn overnight to help move the lower jaw forward, opening up the airway and relieving snoring. And I decided I'm going to learn more about these to help other spouses in the same boat. And so I became one of Australia's first dentists to qualify in dental sleep medicine. And I became involved in treating adult snoring and obstructive sleep apnea. But whilst doing that, I started to recognize, snoring, it's a symptom, can often be a symptom of a greater underlying problem, obstructive sleep apnea, which, really impacts people's quality of life as well as increased health risk. And I wanted to know, how come we're doing this solution, a nighttime solution, which is really a band-aid for poor jaw development? How can we grow jaws better in the first place? And so that's when I started to become more involved with early interceptive orthodontics and recognizing that form follows function. If the jaws aren't growing well, it's really because of oral dysfunction in the earliest years of life. So how can we promote good oral function through breastfeeding, nasal breathing, and promoting all the tongue and muscles to work well early on. So I'm now involved in tongue time management from infancy through to adults, early interceptive orthodontics, and promoting airway health for children.
Well, everyone knows a snorer, whether they've, certainly in co-sleeping environments, there's an issue with snoring.
Mm-hmm.
Have you solved your husband's issue?
Yeah, well, do you know what? Yes, in a way, we sleep in separate rooms. But the problem really is that when it comes to adults snoring and obstructive sleep apnea, it's a developmental problem. The origins begin during infancy. And when we work in children with snoring and obstructive sleep apnea, that is a much easier problem to solve because they're still growing. We can modify their jaw structures, which really form the floor of the nose and the tongue and the rigid framework for our collapsible upper airway. So when children are really young, if we can grow the jaws well and we can get the muscles working well, it's easier to get a more lasting solution. Whereas with an adult, their jaw structures have fully grown. And so to modify them, it's really going to involve more invasive treatments and sometimes jaw surgeries as well. So to get a lasting solution for an adult is a lot more complicated. So it's very limited where I'm from. In other parts of the world, a lot of people are doing adult palate expansion very reliably to get breathing improvements. Where we are, there's not as much provider options. So it's really hard to address those issues in an area where there is not as many providers. And that's why I believe that when we see these adult problems and the despair that it can cause for many people, It's easier if we can identify those missed milestones early and to be able to intervene as young as possible.
Absolutely. And it all begins with awareness. So the listeners are probably thinking, if they have children, does my children have an issue in
Mhm.
relation to poor jaw development? So how can you identify it early?
Yeah. Actually, Anthony, I might actually mention, because you did ask about my husband, he is using a CPAP machine. So that's a really common number one gold standard option for addressing obstructive sleep apnea. So yes, he has got some sort of solution which will help keep him breathing. But realistically, the jaws form the framework for our airway. How can we identify these problems early? We want to know when jaw development is off track. Whenever there's an orthodontic problem, whether it's a narrow palate, a crossbite where the jaws don't fit together, an underbite, an overbite, all these orthodontic problems where there is crooked teeth, it's really a problem with that jaw structure. So when the jaws aren't growing, we need to be able to recognize that. We can take our children to the dentist, and many times they'll be able to be the first person to identify that. And recognizing that if the jaw structures are growing the most rapidly in the first 6 years of life, and 90% of the jaw structures are complete by age 12, that traditional model of watching and waiting whenever a child has crooked teeth or orthodontic problems, we're missing the boat to develop those jaws more fully. So that's a key warning sign that people need to be alert to poor jaw development, but also recognizing that we need to have good nasal breathing. So nasal breathing really is the foundation for thriving health and vitality. We need to get nasal breathing 24/7. And these problems begin when mouth breathing starts as well. And so recognizing that mouth breathing is an issue, any oral dysfunction, so the form follows function, those muscles of our face and mouth are developing our jaws. So when those jaw structures are off track, it's related to poor oral function. So even from the very earliest years of life, from birth, we want to promote good breastfeeding or good latching. So for efficient transfer of milk, we need good tongue suction. And that tongue suction, as the tongue raises to the palate and it drops, that creates a vacuum. So that's how milk is efficiently transferred from the breast. And it requires complex coordination of our muscles. So it really helps develop that muscle tone and gets our jaws growing forward and backward. So breastfeeding is sometimes called nature's palate expander. So anytime we have breastfeeding problems where that tongue is not working really well, that could be a very early warning sign that our jaws aren't going to be growing properly because they're not receiving the proper functional stimulation. Even if the child is on a bottle, we want to have a good latch where they've got a wide open mouth. So any of those clues where children may be sucking and swallowing air at the bottle or the breast very early on in life, that may be an indication of poor sucking and swallowing. We want to try to recognize those early warning signs, the speech problems that may develop if this is not optimized early on, chewing and swallowing, where children aren't able to chew hard foods, and they're not chewing as well. They're all called orofacial myofunctional disorders where the muscles aren't working well. And one of the key contributors to them could even be things like tongue tie, where the undersurface of the tongue, it's actually too short or too tight and it doesn't allow proper elevation of the tongue. And we develop other compensations when that's not used properly, or they can be symptoms as well. So that's where we're going at the moment. I think that if we can recognize that these sleep and breathing problems are often the jaw structures have a central role and we need to develop that well, what we want to promote is good oral function in the earliest years of life, including good nasal breathing, where the tongue is up, the mouth is closed, the lips are sealed, as well as good feeding from the earliest years of life.
And in terms of the statistics about, number of kids affected by this, not having this good jaw development, what is it? And is it increasing?
I'm not really 100% sure about the statistics. It's a really common problem. That's all, a lot of what I deal with in daily practice. But yes, it is thought to be an epigenetic problem related to our environment. So yeah, it is a more common problem. For instance, crooked teeth, it's thought to be a more recent phenomenon over the last few hundred years, coinciding with industrialization, where we are getting very heavily processed foods, which don't require as much chewing. The introduction of mothers working, where babies were then offered bottles and formulas, pacifiers. So yeah, it's to do with that. It's not really a genetic problem. That sort of space of time where that change has occurred is thought to be too quick to be purely a genetic issue. It's to do with our modern environment and the way that we're using our muscles. Even things like, the reduction of breastfeeding and also modern living where we're indoors, there's more allergies. We're going to have to use our mouth to breathe more often as well. They're all altering the way that we are using our muscles and therefore promoting more underdevelopment of the jaws.
Yeah, it's incredible how convenience is costing us both in terms of our health and the environment. So it's just amazing how it all comes down to, we've been chasing productivity, and productivity is coming at a cost. And,
Mm-hmm.
In terms of mental health, in terms of physical health, in terms of the environment, overall, it's coming at a huge cost. And
Mm-hmm.
I think you've really highlighted that in terms of, it's pure convenience in most. I mean, I don't want to be, I guess, being really generic here, but a lot of preferring not to breastfeeding is more of that convenience and having more options and flexibility. Same with highly processed foods. It's just easy.
Mm-hmm.
And so we've gone away from cooking and more into, like, if you look at those, the consumption of those sachets, that,
Mm-hmm. The
the
pouch foods.
yeah, exactly.
Yeah.
Those pouch foods that, it's really just, there's no chewing whatsoever.
Mm-hmm.
And I think some of it is that over dramatized fear around choking. And
Mm-hmm.
so therefore, if they're not chewing, they're safe. And so, yeah, we've gone again, this over safety, over protective in relation to bacteria. You
Mm-hmm.
mentioned that, we're indoors, we've got more allergies. And so, so, yeah, I'm really keen to, I guess, lay the foundations in terms of, like, what's ideal. I mean, obviously, it is situational, and everyone's different. But what would be ideal in terms of the amount of time for breastfeeding, and then the transition from breastfeeding into solids, and what sort of foods are really good to help encourage that jaw expansion?
Yeah. I mean, if the anthropologists who have been studying the incidence of crooked teeth and underdeveloped jaws, they actually found that those pre-industrial populations, looking at fossil records, they would actually breastfeed exclusively for 6 months and then continue to breastfeed for the next few years of life. And babies, the way that they were fed prehistorically is to have their food pre-chewed by the baby, by the parents, and then offered as well, less processing and purees as well. In terms of what is the most ideal food, yeah, just fibrous food. I think that there is a trend towards baby-led weaning, which is really offering babies' first foods as finger foods. It could be like a steamed broccoli or a piece of meat, like a lamb cutlet or something that they have to chew rather than overdoing the purees. And we certainly want to keep those pouch foods to a minimum because they don't require chewing and in fact will promote oral dysfunction or sucking. So there is even some awareness that this increased use of these foods is linked to increased risk of speech delays and speech development issues because children aren't using their muscles properly.
Incredible, isn't it? Just this whole
Mm-hmm.
convenience thing. It really is. Like, I also look at it from an environmental point of view, and a lot of what's costing us in the environment is simply because of us driving productivity and, yeah, and wanting to do things faster. And yeah, so just in terms of, okay, so they now into, so at 6 months, you introduce the solids and making sure there's an element of chewing, but
Mm-hmm.
yeah, obviously, the it isn't just solid, and then so the breastfeeding with solids goes from 6 months to like 3 years, like together. And then from 3 years, is it, what's the, so, and I guess in that period you mentioned pacifiers, they're not helpful. um
Yes. Yeah, I mean, pacifiers, what they do is they actually promote low tongue posture. We really want the tongue up, resting against the roof of the mouth. So that tongue up is great during breastfeeding and then also during regular breathing. So if our tongue is up, it's slightly sealed to the roof of the mouth, it's impossible to mouth breathe. And so it helps promote nasal breathing. When the tongue is down, it doesn't develop the jaw as well. And the earliest years of life is when the jaw is growing the most rapidly. And so when our tongue is up, it actually promotes smooth airflow down the back of our throat. But when the tongue is down during sleep, when all our muscles are relaxed and we're more lying on our back, it's more prone to blocking the airway as well. And this can create sleep and breathing disturbance. So when we have the pacifier, what that does, it actually promotes that lower tongue posture and that increased sucking forces or the forces of the lips and cheeks that actually can create distortion of the palate. And so that promotes a smaller palate and therefore, because the palate is really the floor of the nose, smaller nasal passage as well. So the impact is really related to the frequency, duration, and intensity of use. People think, oh, I only use the pacifier for my baby to sleep, but babies are sleeping for a great duration of time. So the more we can actually remove the pacifier and use it soothe and remove, the less impact that it will have on the jaw development. Yeah.
Yeah, it's again another convenient thing, isn't it? Really, it's like children or babies can be seen but not heard, right?
Yeah. I mean, often sometimes I'll be having a walk and I'll see a child in a pram. They're pretty settled and they've got a pacifier in the mouth. There are times where we could actually remove the pacifier. Other times, babies that are more reliant on pacifier, there's going to be an underlying problem. And a lot of those babies may have things like excessive air intake. And that, in my work that I'm doing, can often be related to tongue tie or these oral restrictions, which actually don't allow the tongue to suck properly. And babies are getting a lot of trapped wind. Oftentimes, when we can address those issues and get them feeding better, there's less reliance on the pacifier. So I always think we need to create more awareness as well as look for the root causes of why is a child relying on this.
And in terms of tongue tie, is that a more genetic predisposition or is it epigenetic, like you mentioned with the jaw development?
Yeah, I don't know enough. I think that there is something epigenetically, but yes, it does tend to run in families.
Okay.
So if a parent has it, it's quite likely that their child will have a good chance of having it too.
Okay. And so I guess some parents are probably thinking out there, I've witnessed a few of these symptoms or my
Mhm.
child having some issues and we've been told that, you can visually see crooked teeth, right? And, I guess overbite, underbite's going to be recognized by dentists more likely. So if concerning parents, how can they connect with you? How can they reach out and get some support?
Yeah. Well, I think one of the things that parents need to recognize is that we want children to breathe through their nose and we want them to be silent during sleep. So we don't want any snoring. I want parents to be able to check and look at their child as they sleep. There should be no sounds. Any sounds is a sign that they're getting obstruction of airflow, that air is not flowing through as smoothly as possible. And we know that if there is any snoring, there's a lot of research to suggest that this can be linked to increased risk of behavioral and learning difficulties later on in childhood. And many parents have these concerns about their child's inattention or their difficulties with emotional regulation or managing themselves. And often children may be going down the diagnosis route of ADHD and that. So what I really want parents to recognize is that if there is any concerns with their behavior or their energy, some children, if they don't sleep and breathe well, they're not going to be tired. They'll be more hyperactive. Any of these concerns, check your child's breathing during sleep. They should be still, silent, not moving, not tossing and turning, and closing their lips with their mouth closed. Signs like teeth grinding, bedwetting, sweating, or these increased efforts to breathe during sleep, unexplained awakenings where a child may go into their parents' room in the middle of the night. Why are they waking? To explore this. And so, yes, the dentist can often be one of the first people to help guide patients what route to go down. For example, in the US, the American Dental Association in 2017 issued a policy statement where dentists have a frontline role or responsibility to screen children at risk of these sleep and breathing problems, because we can see those things like the poor jaw development, the mouth breathing, enlarged tonsils, and tongue tie, all these things, we are frontline to recognize them. So the dentist can often be a first person to go and see. And then there's several routes. You can go down the ENT line, which is seeing an ENT surgeon who largely looks inside the nose and in the back of the throat. And they're often responsible for removing any obstructions or soft tissue swellings like the adenoids and the tonsils. The dentist has a role of looking at the outside. So where the ENT looks inside the airway, the dentist looks outside. So the jaw structures. How can we develop those jaw structures to get the tongue space and the nasal passages and our framework for our throat developed as best as we can? And then there are myofunctional therapists who look at the way that the muscles are working. Because even if we do interventions to open up the airway, whether it be surgery or orthodontic treatment, our ultimate goal is promoting nasal breathing and getting our tongue resting in the palate. And so those myofunctional therapists, they will work on building awareness of those habits where a child might have had their mouth open for a long period of time, teaching them how to use their nose, close their lips, and getting their tongue to work properly. And then identifying if there's any oral restrictions, including tongue tie, which then can be addressed often by a dentist or, some other qualified health profession to be able to get that tongue working up as best as possible. So there's a few different avenues that people can look at. And it's really a multifactorial problem, which means that whenever a child is not breathing and sleeping well, there's never one single fix. A lot of kids, around the age of 2 or 3, they may get adenoids and tonsil surgery done to remove those obstructions from the airway. But is that really a symptom, or is there a greater underlying cause? Because a lot of children that have their adenoids and tonsils out, they'll have some sort of immediate relief, but there'll be still persistent symptoms, whether it be mouth breathing or teeth grinding, which we know is a strong red flag. A child could not be breathing as well as they can. And so we need to, and many of those children, even if they have good relief, later down the track, a few years later, it's not unusual for some children to have the recurrence of symptoms and require another surgery as well. So recognizing that when we have a problem, we need to look inside, outside, and really looking at the muscles, ensuring that we can get closed mouth nasal breathing with the tongue working well at the end of the day.
I love your holistic lens of this issue and the fact that you very much into that preventative side. And that's what I've really enjoyed in terms of this discussion, is how you look at it from a broader picture and how do we prevent it? If we can't prevent it, then how do we help the body heal, in a sense, do what it's meant to do in terms of, develop that jaw structure, those muscles, so that we can ultimately thrive. And that leads me into the book that you've written, Breathe, Sleep, Thrive. So please give us a synopsis of the book and how people can, the listeners, how can they buy this fantastic resource?
Yeah, the book really is originated when I started to do the adult snoring and obstructive sleep apnea. And then I wanted to help parents recognize what are those warning signs that there are going to be problems ahead. So I really try to explain to parents how this problem occurs, how it begins with oral dysfunction and then the jaw problems that can occur. So what do parents need to look out for from the earliest years of life with the breastfeeding, and what are the signs of tongue tie? And then as children grow older, what are the signs of jaw problems? And really helping them to understand and connect the dots, the symptoms of poor sleep. So all the clues that your child may be experiencing issues from the earliest years of life, a little bit of a checklist. And what are the different avenues that parents can pursue to get their child more quality sleep, because it's really not one single solution, as we mentioned.
And where can they find the book?
Oh, the book, the best place is Amazon. It's the easiest distribution. It's available worldwide, and there's many other booksellers if you Google it online as well.
Fantastic. So listeners, I'll include the link in the show notes so you can go directly to the show notes. Click on the link. And I just want to thank you, Dr. Shereen Lim, for coming on the Health Up podcast and enlightening the listeners on the issues surrounding mouth breathing, the symptoms that can come as a result of that, irritability, hyperactivity, And then, as you mentioned, with kids, it could be speech development, and ADHD are some of the things that they may get diagnosed with, which is just a symptom of poor jaw development and muscle development. So I really appreciate you coming on and enlightening the listeners that there's more underlying concerns that we need to address as opposed to just addressing the Band-Aids. If any parents out there have a kid that's making noises at night, teeth grinding and snoring, or just irritable, can't resting, they're moving around constantly because the body's trying to wake them up so they can breathe, reach out to Dr. Shereen Lim and or alternatively buy a book and find out more. So thank you.
Thanks so much for having me, Anthony. Thank you.
You're welcome. Thanks for coming on the show. And thank you once again, listeners. Please share it with others that you believe that could be well supported by listening to Dr. Shereen Lim's advice and recommendations and support around this issue of narrowing jaw, mouth and structures that are really causing a lot of issues, not only in childhood, but adulthood. So please share it far and wide. Thank you.
Beautiful.
Podcast disclaimer. This podcast and any information, advice, opinions or statements within it do not constitute medical, healthcare or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand Me&My Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. Me&My Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor. Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, Me&My Health Up disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of Me&My Health Up.